Pope's personal doctor dies from COVID-19 complications.
Here's a summary of the article.
The weekly tallies of COVID-19 cases and deaths in the United States have never been higher, and state officials are warning of more alarming patterns following the holiday season. The total number of Americans infected with the virus surpassed 22 million Saturday, according to Johns Hopkins University data, and more than 372,000 have died. From the states, Kentucky Governor Andy Beshear said the state was seeing a real and significant increase in cases and our positivity rate from people's gatherings around the holiday. Colorado's state epidemiologist, Dr. Rachel Herlihy, on Friday warned of early signs of a rise in COVID-19 cases. Record cases and deaths. In the 9 days since the start of 2021, the U.S. has recorded more than 2 million new COVID-19 cases and more than 26,000 deaths, according to data from Johns Hopkins University. The nation has averaged about 247,200 COVID-19 cases a day over the past week as of Friday, an all-time high, and more than 3.7 times greater than a summertime peak set in late July, Johns Hopkins data shows. The country has averaged 2,982 deaths a day over the past week, the highest figure of the pandemic, according to Johns Hopkins.
This post received a score of 53,000, with an upvote ratio of 92%. Here are the top comments in response to this article.
Soccorsi was hospitalized in Rome on December 26 for a previous oncological disease, according to the Italian Bishops' Conference newspaper Avenir. It's unclear exactly when he was last in direct contact with Pope Francis.
Isn't oncological disease cancer?
I think so.
It just seems to downplay the fact he had cancer and that he was probably going to die sooner or later, not knowing if COVID was the real cause. Or the journalist just had to reach a minimum quantity of words.
I mean, if he was undergoing treatment for the cancer, COVID is exactly the sort of disease you'd want to avoid because you'd be at special risk of death from it due to likely being immunocompromised from the treatment.
Malignancy also puts you at much greater risk of thrombosis. We are seeing cancer patients that would otherwise live for years die of various thrombotic conditions secondary to COVID.
It's a vascular disease after all. I've got a variety of sources on the topic, if anyone is interested. COVID-19 related severe hypercoagulability in patients admitted to intensive care unit for acute respiratory failure. COVID-19 is a blood clotting disorder masquerading as a respiratory illness, a cerebrovascular perspective and therapeutic implications for stroke thrombectomy. COVID-19 is, in the end, an endothelial disease. Right ventricular clot in transit in COVID-19, implications for the pulmonary embolism response team. COVID-19 associated coagulopathy in Critica.
Has there been any research into whether a person's cholesterol levels play a part in the severity of their COVID illness? I've been wondering if it might explain why some seemingly young and healthy people wind up getting hit hard, since you can be thin but still have high cholesterol. It just seems logical that someone who has some blood clotting already would probably be worse off with it than someone who has low cholesterol.
COVID reduces the levels of LDL cholesterol in your body. COVID causes hyperlipidemia even in the milder of cases and, well, that's bad. 3. Those with high cholesterol have a higher infectivity risk, because their endothelial cells have a greater amount of ACE2 receptors, since cholesterol is concomitantly trafficked with the ACE2 enzyme. Due to number 3, it has been found that cholesterol-controlling medications, such as statins, can moderately reduce the risk of COVID infection in patients with high cholesterol.
Remember people, Pope Francis has been pretty outspoken in trying to get people to both take the virus serious and take proper measures. You can hate religion all you like, but many of these comments are especially misplaced about this pope in particular.
This video was automatically created by Reddit to speech. The article and comments in this video were selected from Reddit according to their upvotes, and any paraphrasing was performed by smmry.com, without any human intervention.